think Mamta is always an inspiration all throughout her career. She has been an inspiration.
Please spare me, Lakshmi.
No. I tell you, Mamta, it's not. I tell you, going into sparing your valuable time, going into the remote corners of the country and treating epileptic patients, creating awareness is not. It's not that easy, and that too with the burden of sitting in the apex institute of the country. Similarly, Nirmal gone to the every nook and corner of Maharashtra, conducting camps, creating awareness on epilepsy. So I'm really proud that there are a lot of advocacy efforts being conducted in the country. We are doing it silently, not on a single banner. Each one is doing in a diversified way. But the way when we unite it, our advocacy efforts are far more than the thing. I think since the time is 4, I think we should. Dr. Roop, I think we should.
Yeah. Let's start. So let me start by welcoming everybody to this Advocacy Subsection webinar. And we have 2 speakers, and then depending on time, we will have a discussion. Can I invite the chairperson, Dr. Lakshmi Narasimhan, to take over and introduce the 2 speakers? Or you'll introduce Mamta and then I'll introduce Rahul.
Mira.
Lakshmi, you want me to do it? Otherwise, I'll do it. Lakshmi, do you want me? I'll introduce otherwise, no problem.
Sir?
I was asking you to introduce Mamta, otherwise I can do so.
Sure.
Okay.
Mamta,
Yeah.
She is my very good friend. In fact, I should say, as far as advocacy is concerned, she inspired me. In one of the meetings, she was talking about the Lifeline Express and how on that journey about almost 6-7 years back. And then both of us have started our journey. Then she told me about the PALF, and then I got into PALF, and then that's how our association on advocacy efforts started. Then we started in fact, she was also part of the Asia Oceanian epilepsy subsection on advocacy. We conducted a meeting in Delhi along with her help in the India Habitat Center with Professor Mahendrata heading the organizational team, where we conducted the AOEC along with the American Academy of Neurology. She is very popular among all the advocacy members in American Academy of Neurology. She has all her efforts she had made commendable efforts in the field of epilepsy, and it's my great pleasure and happiness to introduce Mamta. And now the stage is yours, Dr. Mamta.
Thank you, Lakshmi. That was very kind, and I thank the Academy and Roop and Lakshmi for giving me this opportunity. Considering that we have a small crowd, I think we can probably leave more time for discussion, and I'll make a brief presentation. My screen is visible, right?
Yes. Clearly visible.
Yes. Yeah. So this is briefly about a little of the work that we have managed to do in the last decade or so. And I just saw that in the panel discussion, we are going to be discussing about what advocacy is. So I wouldn't spend too much time on that, but tell you a little about our work on the Lifeline Express, and then a little about the research that is connected to this advocacy effort, and then just a brief kind of capsule for people who are new to advocacy and would like to get started. So you can look at the dictionary for what advocacy means, and it's just the act of. Why am I seeing you guys in a window on the side? Can I make you all vanish somehow? I can't see my own slides.
You can minimize it.
Oh, yeah. Got it. Thanks.
You can minimize it.
So either the act of supporting a cause or a proposal, or a way in which an individual or a group tries to influence decisions, which may be, of any kind, political, economic, social. And if I have to simplify it for in our context, then my slide.
Ma'am, you can click on the slide and.
Yeah. So if I simplify advocacy in our context, so this is where we are, the doctor. Can you all see my pointer? No, you can't.
Yes, I can, Mamta. I can see your pointer.
Pointer. Okay.
Yes.
So this is the doctor. This is our healthcare system, and this is the patient. So one way, of course, that the doctor interfaces with the patient is what our natural work is, So you are interacting, serving, treating patients. As far as advocacy, this also, could actually, without really calling it an advocacy effort, all of us are advocates for our patients, in some way or the other, even in this interaction. And if you think about it in a broader way, the doctor is kind of interjected between the healthcare system and the patient. So you are this arrow. I wasn't able to make it longer, but it needs to extend from the patient to the healthcare system, and in between is the doctor. So if there is something amiss with the healthcare system, or there are any kind of obstructions or any kind of deficiencies in the healthcare system leading to adverse outcomes or experiences in the patient, the doctor can try with his efforts to bridge that gap or to improve that experience for the patient, and this would constitute advocacy. So I think that should make it simple. So even when you're doing this, actually, to some extent, your patient is not able to buy medicines, you just pick up the phone and call the drugstore person, request, could he give a discount? That's also on a small scale, being your patient's advocate. Or you talk to the medical superintendent of your hospital to waive charges for a poor patient. That is also an advocacy, being a patient's advocate. So this is one way that we do it, and I think we do it every day, each one of us, without even realizing it. It comes so naturally to us, and because it comes so naturally to us, if we were to organize and to think about this, in a more wider perspective, we could try to influence the system so that it improves the care that our patients get, and that would be advocacy. Okay, so I go to the next. So this is how it started. Actually, I cannot talk about my little work without mentioning and acknowledging that the American Academy of Neurology, it has this program called the Palatucci Leadership Forum. Unfortunately, because of the pandemic, it's kind of on hold for the last year and this year. But otherwise, it's held over a weekend every year, and they pick about 27 American and 3 or 4 international neurologists to come and get trained over a longish weekend. It's like Thursday to Sunday. And you have to experience it to realize what a useful thing it is. And although I think, so the thought has been there in your head for a while when you reach this forum for training, but that's where your thoughts really get crystallized, and you kind of get a direction, and you get the tools to start to believe that you can realize what you are looking to do. So I was fortunate to get this opportunity in 2008, and I think I probably got formally started with my serious efforts in this direction after that. And this one slide, I will just kind of summarize, the what happens over those 4 days. Some of it is not relevant to us going from other countries. It is more relevant, which deals with the laws and etc., which is only applicable to neurologists from the United States. But this basically is the crux of the training. That's called action planning. And I was able to actually pull this out, from the American Academy website. So thankfully they have it archived over there. Otherwise, I would have not even been able to produce it for you. So everyone picks a topic. So like I picked epilepsy. You don't need to really read the fine print, but so you pick a topic, you decide what is the issue that you want to work on. So I wanted to, work on untreated epilepsy in the broad epilepsy field. I wanted to work on untreated epilepsy, and what are your objectives. So the point of the action plan is that, when you write it down in this format, uh, even you realize what exactly you want to do, because before you've done this action planning exercise, things are quite vague. So the objective that I had in mind was very specifically to reduce the treatment gap, and why you want to do it. So you have to have serious reason to want to do something. Otherwise, just for the heck of it, you may not really do much. And then you describe what actions you want to take. Again, you have to enumerate specific actions, and for each of those actions, who's going to be the target audience, what resources you would need, how you would measure your success, and very importantly for us, all of us who are so busy with our routine work, you have to set target dates. What would be the timeline of these specific actions that you're planning to take so as to attain your objective? So I think for people who are new, if you just take a snapshot of this slide, this is how you need to plan any issue that you may want to work on and start efforts being an advocate. And then once I got trained in this Alatucci forum in 2008, about a year after that, uh, I managed to, get involved with working on this magnificent hospital, which is run on a train called the Lifeline Express. And this is where it began in Vidisha on 19th of June 2009. So it's more than a decade back. And while I acknowledge so many people and so many organizations who have really been a part of this journey and helped me in so many ways, this gentleman over here, Colonel Randhir Singh, he at that time was the heading the Lifeline Express. And I think I owe serious gratitude to him because he was he was a very important facilitator of my starting my work on this Lifeline Express. So over the last 11 or 12 years, we've taken this project, this epilepsy clinic, to many, a little over 100 places. Actually, not all may be charted, but as you can see, most of them are in the states which most lack services for epilepsy, namely Uttar Pradesh, Chhattisgarh, Bihar, Jharkhand, and then there is a scattering of, some other states. A very rare visit to, this was Guntur in Andhra Pradesh. So a very rare visit to the south, but and probably they don't need it as much as it's required in these parts of the country. So this project has taken me to, the length and breadth of the country. And this was when I was starting. So yeah, I look very different. And I was just a one-person show. And I would educate patients. I would see patients in the clinic. I would explain how the medicines had to be taken. So just everything I would do by myself. Of course, it was very difficult, and one could not see too many patients because all of it took so much time. But then over the years, as my journey has progressed, many wonderful people have joined. This is Roop over here, and then there are friends from India, different parts of India, and also overseas who have very regularly been supporting, sometimes in person, sometimes at all times, for other kinds of support that I've required for my work. So advocacy, I think this is one important requirement, that you work towards building a team, because for you to be effective and for your work to become relevant, you do require a team. So I cannot emphasize that enough. And now, what opportunities does, or what all happens on the Lifeline Express epilepsy clinic? Like everyone would know an epilepsy clinic. So of course a clinic does go on. So there is patient care. We go to, like I showed you, remote parts of the country. Most of the places that I go to, I have never heard the names of these places before. I get to know that this is the place that we'll be traveling to. So you take epilepsy awareness to very small and otherwise unknown places in the country, and you make or spread this awareness not just to patients but to caregivers, to other people in the community. That sometimes or oftentimes you are able to catch hold of. Some kind of training is also attempted, and often we succeed in that, talking and training doctors, nurses, and then finally research. So when I talk of research in the context of advocacy, one might wonder, that what exactly am I alluding to? So what is this advocacy-led research, and why do I think it's important? It may not be, may not be important or relevant to every topic or every field that one might choose for their efforts in advocating for patients. But in some fields, especially for epilepsy, I thought there was a serious need for research, because a lot of solutions or a lot of questions or problems that you faced and then solutions that you wanted to offer had not so far been tested. So how are you going to convince anyone to do something if there is no evidence behind it? In today's time, it becomes important that there be evidence. So for example, now we go on the clinic and there is a bunch of patients, and all you have is a few minutes with each patient to make a diagnosis and to start treatments. It's very rare for patients to really be very well investigated and to come with all these investigations for you to have that kind of information on before you start treatment. So my question was that, so people would ask me when I would come back, how are you treating? You see 50 patients, 70 patients, 150 patients were seen in a clinic, but they don't have scans, they don't have EEGs. How can you start treatments and be confident that you have probably made a right diagnosis and also given the correct prescription? So that is what drove this research. Looking at can treatment be started without investigation? So basically, you use investigations to differentiate between focal and generalized epilepsy, because that's an important determinant of what treatment the patient would get. And in this study, we found that if a patient was investigated versus if a doctor looked only at the patient, the two were almost always, they would almost always arrive at the same decision regarding whether the epilepsy is focal or generalized. So this was in one way evidence that it is not very out of place to agree to start treatment in patients in such outreach clinics, even if there is no investigation available. Then another question was that we are seeing patients on the Lifeline Express and then we are vanishing. There is no mechanism for follow-up. how do we know that patients continue treatment? So then we did a couple of, research projects regarding that. And we found that this was a follow-up study which was done in patients who had been started on treatment within about 6 months. So we looked at, were they continuing to take treatment? And of the patients who could be followed up, almost 70%, a little over 70% were continuing to take treatment. But this was within 6 months of their having been started on treatment. So the question still remained, what happened in the longer term? So more recently, we did another study where we looked at what happens in the long term. So here the follow-up was up to 5 years. And here again, we found that, and the comparator in this study was patients from All India Institute. And we found, I was very surprised to see, of course, lifeline follow-up or the continuation rates of treatment in patients seen in the lifeline clinic was not as good as the All India Institute, but the All India Institute also didn't have 100% patients continuing treatment. They were dropouts from treatment here too. And it was only marginally worse, I think, So we could show evidence that a single visit also is quite impactful if there is no other way to get a patient started on treatment. An outreach clinic is a wonderful idea to do. Then there was another question about, I wondered because, there is a lack of primary care, and unless we're going to address that, there's no way we are going to narrow the epilepsy treatment gap, because a few tertiary care centers here and there in a few big cities is not ever going to reach, the millions of patients who are in smaller towns and villages. And that was just, this study was just to study that. And we looked at patients who were coming to AIIMS, and we found that almost 43% of these patients who come to AIIMS to a tertiary care center actually do not require tertiary care. They would do very well with primary care, and the only reason they've come is because there is no primary care. So this is evidence that we need to not make another, dozen or 2 dozen AIIMS. We need to reinforce and improve our primary care centers, the district hospitals, the CHCs, PHCs. That's what we need to be working on. Then this was another question, because a lot of times in these smaller places, the hospitals do have a nurse. They oftentimes, most of the time, in fact, would not have a doctor, but many a times they would have nurses. So we also looked at, if a patient was diagnosed and started on treatment, how good was a nurse at following up these patients compared to the neurologist? And we found excellent results for this too. So here we are building up evidence. Of course, there is a gap, a translational gap. So now, these evidences which we are producing, at some point, what needs to happen is that if we are in some way able to influence policy and have these kind of included in the care packages that we are offering to patients. What's this? So anyway, so the title's gone. This was a randomized telephonic review of patients. And this was done in 2017, or rather written up in 2017. I think it was done in 2014. And this study again showed, so because when we are looking at patients on the lifeline and coming and trying to follow them up on telephone, we don't have any evidence if this works as well as seeing patients face-to-face in the clinic. Here again, in this randomized trial, we showed evidence, class 1 evidence, that a telephonic review is as good as a face-to-face review. It is in fact better in that patients also save large amounts of money and also significant amount of time. And there were fewer follow-ups when you are following up patients on telephone versus insisting that they come to your clinic. I think I've lost a couple of slides. Okay, fine. So the slide that I've lost is another slide where we showed the injuries. We compared injuries in patients who have been seen on the Lifeline clinic, because those patients are either not on treatment or are on very inappropriate treatment. And this has probably not been shown anywhere, because the West doesn't have this cohort of patients who are not on treatment. So There's no way they can compare such patients with patients receiving standard care. So the Lifeline, it gave us this opportunity, and a comparison, of course, showed, intuitively, that, of course, injuries are far more significant and far more serious in patients who are left untreated or poorly treated. So all this work was going on and was being published. And then in 2019, the WHO has come up with this first document about epilepsy. And I was fortunate. I was a part of the contributors to this. And we tried to, emphasize that unless epilepsy is considered a public health problem, unless we empower primary care providers, there's no way that epilepsy treatment gaps are going to be in any way diminished. And insisting that just a neurologist diagnose and treat epilepsy probably is really not good enough, not for our country. And very recently, we have managed to get funding for this project, which is again a primary care epilepsy project for Chhattisgarh. This is just to study if, one goes into the community and interacts with the local caregivers, doctors, health workers, how much can you impact or narrow treatment gap in that community. This has been funded, unfortunately, because of the pandemic. There's a little delay in the project getting started. And finally, for people who are interested in advocacy and just, kind of get overwhelmed, wonder where do they start, the first thing is you have to identify what are you really interested in. That's, I think, the most important thing. For you to really see, find a gap. What is, and I think for gaps, you don't really have to look very hard in India. You will find gaps all around. So what do you care very most deeply about? Then you work on your action plan, like I had briefly outlined earlier. Very, very importantly, build a team. Then always anticipate problems and have some alternate solutions. When you set out on some such journey, things seldom go according to plan. So be ready to change course and have a plan B. And most importantly, persevere. Stick with it. Things will work out. And finally, I must acknowledge a lot of people. It's not possible to name everybody. There have been so many people, both at my institute, my colleagues who fill in for me every weekend. Every month I vanish for 2 days, 3 days, and they fill in for me. They've been doing that for more than a decade now. Nobody complains. That's really wonderful. The people who come along with me, Roop is there. There are a lot of epilepsy educators who come along. A lot of my residents help in so many ways. So there's a lot of people who I owe all the work that we've been able to do. I give them credit for that. And thank you. I think with that I'll end.
Thanks, Mamta. We'll save up questions till the end. So let me just go on and get Rahul in to start.
Yeah, sure.
Right. So let me introduce Dr. Rahul Bawaskar. He's my friend and colleague from Nasik. He's pretty senior in practice there, and he's a very busy neurologist. And he is talking about something that we are all part of, because he's the current secretary of the Maharashtra Association of Neurologists. Over to you, Rahul. Can you start?
Yeah, thank you, sir. Yeah. Am I audible? Hello. Yeah.
Yeah, very clearly.
So good evening. First of all, I thank Dr. Gursani sir for giving me an opportunity to speak on this particular advocacy of our own WhatsApp group. So little bit about history of our Maharashtra Association of Neurology. I think somewhere between 2003 to 2004, during an IN meeting at Nagpur, one of our senior colleagues, Dr. Manoj Gulhane sir, Dr. Chandrasekhar Meshram, Dr. Neeta Mehta ma'am, and Dr. Nirmal Surya sir, during a casual talk, decided to form Maharashtra Association of Neurology. The main aim that time was to improve the camaraderie between the neurologists in Maharashtra. It was sort of decided it should be something like a get together of neurologists in Maharashtra, more of a family kind of get together also. That was the initial aim of Maharashtra Association of Neurology, and simultaneously academic will definitely be there. And with this intention, the first meeting of Maharashtra Association of Neurology was conducted at Lonavala in the year 2005. Dr. Neeta Mehta ma'am was the first president, and Dr. Nirmal Surya sir was the first secretary of this inaugural meeting. Later on, once the WhatsApp came into picture somewhere between 2012 or 11, Dr. Makrand Kanjalkar, a senior neurologist from Aurangabad, he formed his WhatsApp group in the year November 2013. So soon our man WhatsApp group had different branches also, as in many groups you will see, like we have a political group, we have a Dhamal group, we have an investment group also, where most of the doctors discuss their investment policies. They give suggestions also regarding share markets, mutual funds, and etc. In the political group, as we all know that we Indians like films and politics, so we have intense fights also on the political group, and we enjoy those also. But the main core group is our main academic WhatsApp group, that is our man group, what we call it as. So it is our main strength, it is our main group. It was, as in the beginning, it was initially started with aim of just messaging or to remain in touch like the rest of the WhatsApp group. So we used to wish friends on their birthdays, congratulating them on their achievements. So like a routine, even good morning messages. So that kind of routine stuff was there in the beginning in this group. But soon it became an important academic platform for neurologists in Maharashtra. It has become one important thing which Maharashtra neurologists always look for. And slowly it widened its scales to various other social aspects as well. So just when Dr. Gursani sir asked me that you have to speak on WhatsApp group advocacy, I was little stunned because I just wanted knowing the meaning of it, but what exactly advocacy mean and how the WhatsApp group can do advocacy. That was the question in my mind. So I just started to find out the definitions. And I think two things I like that one of them, Mamta ma'am also discussed about the definition. Advocacy involves promoting the interest or cause of someone or a group of people. And advocacy is also about helping people find their voice. And I think after this definition was clear in my mind, then I looked back in our at our WhatsApp group and really thought that our group is definitely involved in advocacy of some kind. And let us give some examples about it. The first important aspect of our WhatsApp group is obviously academic. So it's an important platform for discussion of complicated neurological cases. So we generally discuss our complicated neurological cases here and get opinions from various seniors from different parts of Maharashtra. And the important aspect of our group is we have very subspecialist radiologists also in our group. So even radiologists, they give us opinion about various MRI and CT brain finding, which are WhatsApp on this particular group. Some international experts, somebody like Dr. Kailash Bhatia sir is also a part of our group and provide his inputs whenever it is required. So it helps a neurologist even in remote areas. Somebody is practicing in Chandrapur, somebody is practicing in Gadchiroli or some part of Marathwada and Vidarbha. So it helps to tackle certain complicated cases where it is not possible for the patients to visit metro cities for second opinion, or there are financial constraints. If the patient is poor, he can't go to other place. So in that scenario, the local neurologist, with the help of the senior people's opinion on the WhatsApp group, can help him to manage those difficult cases. Even important decisions like whether to thrombolize this particular case or not, the time window has been crossed, there are certain complications in that particular patient, you post it on your WhatsApp group and you will get a lot of answer immediately from the expert. So it helps to tackle these complicated cases, but just by messaging on this WhatsApp group. To give some example, these are certain screenshots of our WhatsApp group discussion. I think this was one of the cases which was recently discussed. This was about a young lady with a large venous hemorrhagic infarct due to left transverse sinus thrombosis, which rapidly deteriorated, and because of raised intracranial pressure, required to do a decompression craniotomy. But the interesting part of her history was she had received Covishield vaccination 15 days prior, and her platelet count on presentation was low. So immediately a thought and a discussion about vaccine-induced immune thrombocytopenic purpura came into play. Suggestions were asked, PF4 assay and D-dimer were decided to send, and an important decision whether IV IgG need to be given in this patient or not. Those kind of things were discussed in this group, and we got an answer. This patient received IV immunoglobulin, and slowly that patient is improving also, and the platelet count has also improved. This is another important thing. Such kind of images are regularly discussed in our groups, and this is some people ask it in the form of quiz also, and then later on discussion on that topic. So this is these are arsenic fit. So this is due to arsenic poisoning. Another case which was discussed by Dr. Gulani recently was a postpartum lady who had presented with rapidly worsening bilateral lobar hemorrhages. So obviously postpartum situation, so differential diagnosis was cortical sinus thrombosis versus PRESS RCVS spectrum. So the doubts were there. MR venogram was not showing any significant finding. Even angio, MR angio was normal at this stage. So here radiologists also come to our rescue. Here one of the radiologists from Pune, Dr. Yogeshwari, she had discussed this imaging findings in detail and suggested that this looks more like hemorrhagic PRESS RCVS spectrum, and which helped in the management of this patient later on. This is just, I could not share one, but Dr. Kailash Bhatia sir also very actively participate. This is just one photograph he came across at the Royal College of Physicians Museum site, young NH Wadia sir. So such kind of things, such light things are also shared on our groups, but Dr. Bhatia sir also very actively involved in academic activities in our group. Second important advocacy point will be support for junior neurologists. We all know that how difficult it is for a newcomer neurologist to establish trust in the mind of his patients and his relatives. Here also our WhatsApp group comes to the help. Many junior neurologists feel free because of the great camaraderie. We meet in our annual meetings. So they feel free to discuss their complicated cases. Even those are routine cases, they try to discuss those things. And sometimes the WhatsApp opinion of the seniors help them to counsel the patient and patient's relative about the management part of it. Sometimes the patient can't be sent for second opinion to other places. So in this, it is definitely helpful for a junior neurologist also, because he gets opinion from senior neurologists, and it is helpful for him to establish a practice also and to counsel and give effective management to the patient. Third aspect is academic and teaching activities. Here, I think the FINE group along with some MAN members, they are doing an excellent job. FINE platform, everybody is aware of, but MAN members are also actively participant of this FINE group, which is initiated by Dr. Rahul Bawaskar sir and Dr. Sudhir Kothari sir. So a lot of academic webinars were organized during this lockdown period, and they were response to those during the lockdown period was overwhelming. Very unfamiliar topics like transient global amnesia, progressive multifocal leukoencephalopathy, various topics were covered as per the suggestions of the practicing neurologist, and these were very well taken by the neurologist. Information and links about these webinars. We all know that the Tropical Neurology Subsection, the Movement Disorder Society, the Epilepsy Society, all are conducting their webinars during this lockdown period, and information and links about these webinars are also circulated through this WhatsApp group. And the attendance was overwhelming, and all these topics were so this aspect of teaching webinars was also through Man WhatsApp group. Teaching program for PG students also through the Fine platform for DM, DNB student. The senior teachers like Dr. Khadilkar sir, Dr. Katrak sir, taking a clinic of the students have been the highlight of these webinars. Dr. Rakesh Singh and Dr. Shripad Pujari, these are the Man members who have taken lot of effort to make these webinars very successful. So these are regarding the teaching activities for the postgraduate student and from their examination preparation point of view. Even teaching activities are conducted through WhatsApp messaging. Our morning of WhatsApp group is with the quiz question. One of our senior colleague from Jalgaon, Dr. Sunil Gajre sir, always put a neurology quiz. Most of the times it is from the AAN, also American Academy of Neurology. People try to answer that, discuss the various answers, and a lot of analysis regarding those answers is done by senior members. So every morning, our day on a WhatsApp group begins with a quiz question. Our young Turks, Dr. Girish Soni from Mumbai, Dr. Dhananjay Duberkar from Nasik, are very active in conducting these academic activities through WhatsApp messaging. Another important success story of our Man WhatsApp group is collaborative work. Collaborative research work has been another success story. Senior teachers like Dr. Satish Khadilkar sir and Dr. Meshram sir took great efforts through discussions in the Man WhatsApp group to create an environment for collaborative work. In fact, a special devoted session for collaborative work was included in one of the annual Man conference at the request of the members. And now we are seeing the fruits of these activities. Few example I will like to give that Dr. Shripad Pujari from Pune did a fantastic teamwork in neuromyelitis optica cases. He collected cases from all over Maharashtra and already presented a paper on that. A recent example being a collaborative work on mucormycosis. Recently, we had seen a sudden surge of mucormycosis cases in post-COVID diabetic patient. So he did an excellent study which was involving 21 centers from Maharashtra and almost contributed 121 cases. And the maximum contribution came from the inner part of Maharashtra, like Amravati, Dr. Sikandar Advani, and from Aurangabad, Dr. Anand Soni have contributed significant number of cases. Today, I was speaking to Dr. Nirmal Surya sir, and he said this collaboration is going to go on a national level as well. So this is one of the things which our Man WhatsApp group have done, that collaborative work have started, and there are various different one person who is interested in that subspecialty is taking the lead, and a collaborative work have already started through this Man WhatsApp group. So this was some discussions regarding the mucormycosis cases. Many research papers from Man members have been published recently. At the World Congress of Neurology at Dubai 2 years back, with motivation from Dr. Meshram sir, almost 50 papers were submitted from the Man members. So definitely this Man WhatsApp group advocacy is helping in research work as well. And lastly, the social advocacy. Man WhatsApp group has not forgotten its social responsibility. We have proven that though academics is our priority, when our country needs, when we are going through a very sad period presently, the COVID pandemic, we are ready to help the society through our medical skills as well as our financial donations as well. During our routine WhatsApp discussions, Dr. Sudhir Kothari sir made an appeal to donate freely and voluntarily for one reliable non-governmental organization, that is Bharatiya Jain Sangatna, which has an excellent track record. They are very honest. They have done previously such good work during the Latur earthquake as well. And they have made a call to do donations for buying oxygen concentrator, as they have become very important in this post-COVID period or in this COVID period where the patient need to be managed at home and there is scarcity of oxygen, and some of the cases can be managed with the help of home oxygen therapy where oxygen concentrator can be helpful. So at his one call only, many Man members made voluntary donation for this particular social initiative. In fact, this aspect was on the same day when he made an appeal, the same thing was discussed as a secretary by me in our executive committee WhatsApp group, and executive committee immediately gave a green signal and a donation of 5 lakh was made for this particular social initiative for buying this oxygen concentrator. So this was regarding certain screenshots of our oxygen concentrator buying thing. So sir is saying that a man is the backbone. These are the words of Dr. Sudhir Kothari sir, that man is the backbone. You guys can help in any cause, be it academic, social, emotional, or just fun. So this is what the camaraderie, this man WhatsApp group at present is sharing. And another important thing with our President-elect Dr. Nirmal Surya sir, since last many years, is conducting camps in various civil government hospital for the epilepsy people. Every 3 months, I think the turn of each district comes, and at his one single WhatsApp call message that the camp is at Dhule, possibly this time it is in Dhule, this time it is in Gadchiroli, he gives a WhatsApp message, and the people in that particular area, the neurologist in that, suppose it is Dhule, then the people, neurologists from Jalgaon, Nasik, Nagar, devote one of their Sundays to provide their free services for these free epilepsy camps. So retrospectively looking, that our WhatsApp group has become an important part of life of our Maharashtra neurologists. And just we have never thought that we are doing some kind of advocacy, but looking back, I think we are doing a lot of efforts through this WhatsApp group. I think, thank you at this.
Yeah, thanks, Rahul. That was perfect. Lakshmi, are you there?
Yeah, wonderful talk, Dr. Rahul. And it's really inspiring for all the other state associations, though also have WhatsApp group. And this would, I think, it's an eye-opener for most of the state-operated groups, so that they can also envisage into the academic activities and the social advocacy. Beautiful, really inspiring. And my salutes to the Maharashtra Association of Neurologists. I know you have been guided by the doyens like Roop Gursahani, Satish Kadilkar, Nirmal Surya, Meshram, and Sunil Gajri and all. I'm very, very proud of all of you. Over to Dr. Roop Gursahani.
Right. So how do we want to handle this? Now, there are some
comments and questions.
Messages, yeah, questions in... are you there, Mamta?
Yeah, I'm
Hello?
there. Yeah.
Okay.
Yeah.
So the first is a series of questions by Professor Partha Ray. They are largely to do with the nurse-led clinic and other stuff. Can you take them one by one? Then we can go quickly through these.
So where are these questions?
Okay, I'll read it out to you.
Okay.
The first is that the nurse, if you click on question and answer, you'll get it there.
Okay.
You'll have a box open up there.
Right. Yeah, I got it. Okay, so the question is that, yeah. So you write that the nurse-led clinics are available in UK, etc. Yeah, so the problems of credentialing, supervision, etc., etc. Absolutely, all that will have to be considered, but you have to start somewhere. So what we started with was gathering evidence. I mean, the Indian Medical Council, or whatever is now the equivalent of the Indian Medical Council, whatever that's called, I don't think they are going to buy an idea. I think nurse-led clinics are not very recent. They've been there for an eternity in Europe and including UK. But that's not enough for us to have a similar model of care in our country. So all we've done is we've started with showing evidence that our nurses can follow up, that technically they are able to advise patients as well as a neurologist can, and of course also flag issues for which a patient should go and seek a doctor's opinion. Now, this is not just the end of it. It of course, we have started at AIMS since the time that we published that work. It has become a regular part of the curriculum of our nurses' training. We have BSc and PhD nursing along with MSc students also. So we have MSc neuronursing and PhD neuronursing. it's become a regular part of their training to prepare them. But further issues as to, how would this now be amplified for on a wider scale for nursing trainings to include this, it will have to be taken forward. So I think that's what you're asking. And will neurologists agree to delegate? Well, neurologists aren't there to take care of patients. So I wonder if they would be able to obstruct, care that somebody else is providing, which they are in no position to provide. So for example, a patient travels all the way from Bihar, Darbhanga to New Delhi, gets some prescription and goes back. Now, there is no neurologist in Darbhanga, to take care of that patient. Suppose a nurse is trained to follow him up locally. I don't see any, any neurologist kind of being upset about that.
Yeah. Okay. So I'll actually jump to there are only two people asking questions. So the second is from Dr. Ozturk, and he's asked about whether there's any legal risk for thrombologists. Actually speaking, this is because the WhatsApp group is just a consultative mechanism for neurologists. Eventually, it's a neurologist who's going to be handling treatment. It's basically only a neurologist who wants a quick second opinion from his colleagues in the group. I don't think there are any legal issues here in this consultative mechanism that we have. There's more from Dr. Parthare. Can I ask Lakshmi to answer?
Rup, also for the legal issues, I think the Telemedicine Act that has come into place since March 2020. It covers a lot of specific care that is being provided remotely. I'm not specifically sure about WhatsApp, but I think a lot of it is covered. So Rahul could even look into that.
Can I contribute?
Yeah, Lakshmi can answer that.
In fact, we have a WhatsApp group. It is exactly in the National Health Mission. We have a stroke thrombolysis group where we have we have about 23 hubs and 55 spokes. All of them are connected by this WhatsApp, and if there is any difficulty, these spokes, they contact they send the image, and the radiologist, they log in and then give the aspect score. We have a format which says hemorrhagic or non-hemorrhagic. What is the aspect score? Is there a large vessel occlusion? Yes or no? Is the patient can be thrombolized immediately? And fifth question would be whether should be transported to a higher center by following thrombolysis. So these same format, every the radiologist or anybody who is online in the group respond, and most of them are very screened and taken their qualifications and all other things, and then only let inside that. And their opinions are, they also give we also have a disclaimer signed at the upfront that these opinions have to be weighed by looking at the patients. All those things are incorporated into the rules, the initial formats, which when they join the group, they'll sign that, and it's a fairly well-protected legal entity. I think you can go ahead with the opinions. Now that it is double-side encrypted, it doesn't leak out. Only thing, you should be very careful of cross-posting the personal information onto other things. That is very, very important. You should never forward some personal information which is prohibited under the Health Information Privacy Protection Act. So you have to be very careful and be very aware of this before forwarding whatever content of this to other groups. In fact, one of the X-rays of an actress with a copper T was forwarded, and that got into a lot of complications in the patient, and the doctor had to get a penal erasure from the council. So you must be careful on forwarding your information to others or cross-posting across the groups. As far as possible, when you are within the group, there should be no issues.
Okay. So again, there are, I'm going to, if the panelists can read, Professor Parthare has written up his views on advocacy. There's a short comment there.
So
Yeah. So maybe before we end, we can have a quick comment on what advocacy is and what we look forward to. Since Nirmal is there, I'm going to ask Nirmal to start first, then Rahul, and then the rest of us. Nirmal, are you there?
Yeah, I'm there.
Okay. Would you want to comment on what you think about advocacy? Then I'll ask Rahul also to comment, and then we'll go on.
Yeah, so I think it was an excellent session. Both Mamta and Rahul has given two different dimensions, one about the epilepsy and one about the organization. So both are different. I have been actively involved in advocacy for past many years, and it can really change the way you are looking at a disease perspective. So, like in epilepsy, we have been done the advocacy for past couple of years, and what result is that in about 5 years, we have more than 100 women got married by declaring themselves that they are having epilepsy. And that's something is a change which can come up, because there was a time when they will not declare the patient as an epilepsy. They'll get married. After marriage, invariably within first few days, the women will get seizure and they are sent back. So I remember distinctly one patient who had a divorce because of epilepsy. And then she got remarried about 1.5 years ago. And then she came to me, and in front of everybody, she brought her husband, and she said, I told him that I've got epilepsy, and we got married, and we are very happy. I asked the man, he said, yes, but that can happen. She's fine, she's doing all other work, and we'll take the treatment. So advocacy can really change the way, if you have time to explain to the people, get them on your side, it can change. And I think, Roop, you are doing very well. I think there are certain diseases which needs advocacy, and one of them is epilepsy, early treatment in stroke. Some of these diseases like life end of life care, where you are doing it, like motor neuron disease, which are going into the final stage and patient has no hope. Advocacy is something which they may accept and do what best can be done. So I congratulate you. There are nearly 25-30 people who have come on Sunday afternoon at 4 o'clock. And that means they are really interested in knowing. And Mamta, you showed how you got that American Academy of Neurology advocacy certificate. And that's important. I think young people from India should take that responsibility to get themselves selected and trained for that. That will definitely help India, Academy, and the people of India. Thank you.
Right. Rahul, you have the last word, and then we will close.
I think for me, advocacy is helping a cause of a people or group of people. So whether you are helping your colleagues, you are helping through the research work, whether you are helping your patients, whether you are giving some financial donations for some activities, I think these are all small acts of advocacy only. And as a doctor, as our profession demands that, I think every doctor should be involved in some kind of advocacy in his day-to-day work.
Roop,
Yeah,
I need to just answer this. Partha is asking if patients' family are.
Oh, yeah.
He's asking if doctors are best advocates, or are they nurses and patients' relatives? So that's a valid question. And doctors being advocates, these are not, I don't think these are mutually exclusive, that there needs to be just one advocate and that has to be the doctor.
Yeah, I agree.
We are all a team. I think we are all working for the patient. We are all on the same side. So, and there are aspects, especially when you think of it in our context, because many a times our patient relatives may not even know enough, to know what they need to advocate for. I mean, they don't know what should be available to them, what are the options. So I think our responsibility increases in our context. And maybe, I think Partha is practicing somewhere else, I think so, in UK. So our
Yeah.
situation is a little different. Yeah.
So, for instance, I mean, I'm part of the International Neuropalliative Care Society.
Yeah.
And for this, right from the beginning, families, family members, family caregivers, we are accepting them as members from the beginning. So it's well, I mean, although it's a society for physicians, it's going to be an important collaborative effort for everybody as well. Right. Can I call on Dr. Lakshmi Narasimhan to
Yes,
do
sir.
the honors of closing it?
Yes, sir. It's my pleasure, and my salutations to Rahul and Mamta Bhushan, but taking a train journey, other through the cyber journey. Both of them have taken, the destination was advocacy, and as Mamta rightly put, everyone should have a dream, and the dream should be what they really want. And once they start dreaming, they should form a team. Advocacy can be successful only if it's a teamwork. And she really pointed out that in a fantastic way. And similarly, Dr. Rahul has really made us feel jealous of the Maharashtra Association of Neurologists, of how effectively they have put the WhatsApp group, which is presently is the cause of the pain of the infodemic, in other words. So in amidst these tough times, he has highlighted how effectively the WhatsApp can be used. And Dr. Roop Gursahani has done a great job in organizing this advocacy seminar, of putting everybody together. And I thank all the attendees for spare their valuable time. It's a beginning senior people like the Rajinder Jameja, Professor Venkamma, and a lot of senior people have attended. I'm very happy I thank each one of them. I thank the IAN to have given I thank Professor Nirmal Surya, IAN digital team, and also the digital team of Bhavesh Thakkar for communicating effectively to all of us to join this. Thank you so much. Stay safe, stay healthy. Thank you.
Okay.
Right. Bye, everyone. Thanks,
Bye-bye.
Mamta. Thanks, Rahul.
Bye. Thanks, Mamta.
Bye,
Thanks,
Lakshmi.
Rahul.
Bye-bye.
Bye.
Bye, Roop. Bye, Lakshmi. Thank you.